Good afternoon and welcome. It is my privilege and pleasure to, on behalf of the commissioners and town staff, to welcome you to this special announcement today. Today is an important and exciting day for our town, and I hope that once you understand the details of this announcement, that you will agree with its significance to all citizens. And now I would like to welcome Lauren Blackburn, our planning manager, who will give us the details of this very special announcement. Lauren?
Thank you all for joining us today. We are thrilled to announce that the town of Davidson has received a grant from the Centers of Disease Control for a total of $350,000 over the next 3 years. The grant, which comes from the CDC's Healthy Community Design Initiative, will help us promote the Board of Commissioners' primary goal to establish Davidson as a national model of a healthy community. The town is one of only 6 agencies selected from a large pool of competitive applications nationwide to receive the grant. The other agencies receiving this award include the City of San Francisco, the State of Massachusetts, the State of Oregon, Douglas County, Nebraska, which includes the City of Omaha, and the City of Baltimore. Davidson is, by far, the smallest in population of the recipients and the only community in the Southeast. We are also the only recipient who is not a public health agency to receive this recognition by the CDC. The CDC's grant will fund Davidson Design for Life, a project that will allow the town to conduct 3 health impact assessments a year for 3 years. The town will also provide training and technical assistance on how proposed projects, policies, and decisions at the local level can impact community health. The CDC's award requires no local match. The funding will pay for an additional staff person who will manage the health impact assessment projects. The job description for that position will be posted to the town's website soon. Davidson Design for Life, also known as DD4L, will enable the town to better communicate with residents on critical issues such as active living and quality of life. It will also promote the town as a great place to visit and will allow us to study how good planning can yield a healthy and vibrant lifestyle. According to the CDC, the town was selected as an award recipient because we possess a number of strengths. Among those, the CDC cited that Davidson is a recognized leader in smart growth and affordable housing and is committed to health and the built environment. The CDC also appreciates the interdisciplinary approach between our planning and parks and recreation departments, recognizes that Davidson has a unique opportunity to serve as a model of sustainability and share our story with other small towns and rural communities, and is committed to consideration of health in planning in the long term. As a part of DD4L, the town will work with a wide variety of regional stakeholders and experts in the fields of public health, environmental sustainability, and education. Staff from the CDC had hoped to join us here today, but were not able to due to travel restrictions. We are all looking forward to working with these fine folks. Now, I'd like to invite Davidson Commissioner Margo Williams to explain the vision for Davidson Design for Life.
Thank you, Lauren. In 2001, 2 public health researchers wrote these words in their book, Creating a Healthy Environment. The challenge facing those with responsibility for assuring the health and quality of life of Americans is clear. We must integrate our concepts of public health issues with urban planning issues. Urban planners, engineers, and architects must begin to see that they have a critical role in public health. Similarly, public health professionals need to appreciate that the built environment influences public health as much as vaccines and water quality. We are here today standing on the shoulders of people like these researchers and others who came before us, of leaders in Davidson and from across the country. For many years, local leaders have focused on developing citizen-guided core values, and the current board and staff have taken their good work and added to it. We realize that our planning and programs can either lend themselves to the public's health or detract from it. We chose to add to it through more parks, open spaces, sidewalks, bike paths, safe streets, and programs that encourage people to get out and use these green and healthy places. Our selection by the Centers for Disease Control to participate in creating health impact assessments ensures that we are many steps closer to our goal of providing ways for citizens to achieve mental, emotional, social, economic, and physical health. Used to evaluate the potential health effects of a project or policy before it is built or implemented, HIAs are intended to increase positive health outcomes and minimize adverse health outcomes. In 1992, Davidson began a conversation about this years ahead of the national curve, establishing community gatherings that resulted in the writing of our general plan. More recently, in 2010, the town board continued the citizen discussion by adopting the Davidson Comprehensive Plan. It gave us a renewed vision as expressed through core values that focused on the creation and preservation of a healthy environment, village center growth with diverse and connected neighborhoods, reservation of rural areas, provision of public spaces, and protection of watersheds, trees, air quality, and other elements of Davidson's ecology. These core values outline the sort of integrated thinking that involve every town department and every citizen needed to build a healthy community, and they address many of the criteria considered by the CDC in creating usable and sustainable health impact assessments. So once again, the citizens have spoken their clear desire for Davidson to be a connected, walkable, healthy community. And happily for us, the CDC listened. Through its Healthy Community Design Initiative, the CDC stated that the way we design and build our communities can affect our physical and mental health. Healthy community design integrates evidence-based health strategies into community planning, transportation, and land use decisions. Mostly, I stand here as an emissary of thanks for those who came before, for the Davidson Design for Life Committee, and would you raise your hands? For staff, and would all the staff present please raise your hands? For elected leaders. And now here's your chance to raise your hand for the hundreds of citizen participants who made this possible. We thank you. We also thank Deborah Ryan, Associate Professor of Architecture and Urban Design at UNC Charlotte, and her master's degree students who spent a semester studying, researching, and interviewing in Davidson to write their book, Small Town Fit. It is encouraging to see our town through their eyes. And we thank the CDC for believing in us. We are honored to be their partner in this effort and to have the opportunity to work with the other fine award recipients. We believe that Davidson will blossom with these new partnerships and that our citizens will offer others a unique perspective on what it means to live shared lives in community. Thank you.
Thank you very much. We have time now for questions or comments. If you have a question about this announcement today, I know there's lots of details yet to be communicated, and we have packets of information for those of you who are interested, but we would welcome questions at this point. I've got a team of experts right behind me. I think they can handle questions. Yes, ma'am.
When do you expect to begin?
When do we expect to begin?
Yesterday.
Yesterday is the answer. I believe we have begun. Any other questions? Well, our sincere thanks to all. Yes. Oh, I'm sorry. Yes, there will indeed be a way for citizens to get input and to participate in this planning effort, and we'll cover that in further detail. We sure will. Absolutely. We definitely want citizen input. Yes, sir, Mr. Fuller. All right. Thank you, sir. Any other questions or comments? Our sincere thanks to all of you for attending this special announcement on such short notice. We urge you to stay involved as we engage the process, and there are plenty of ways to be involved. Also, you can follow the progress of this work through the town's website at the tab identified as DD4L, Davidson Design for Life. I would also like to take just a moment to acknowledge two announcements. One, the town has just been designated as a fit community for 2011 through 2014 by the North Carolina Physical Activity and Nutrition Branch of the Department of Health and Human Services. That's a great move for the town. And also recently announced the town has won and been named to 3 state planning awards for the Circles at 30 planning, our comprehensive plan work, and our affordable housing ordinance. These 3 awards are made by the North Carolina chapter of the American Planning Association. So we offer all of you who have been involved in all of that work sincere congratulations. We hope that these announcements today are the kickoff for a great opportunity for our town and for all of our citizens. We thank you for coming today. We look forward to more information to be communicated on this issue and to all of your participation as we enter the world of a fit community. So thank you for coming.